could lead to blindness. Pterygium is an eye condition which manifests as a benign or non-cancerous growth on the eye. If not surgically removed, ophthalmologists say could cover the entire white part of the eye and over the cornea, which is the clear and front part of the eye, which also causes blindness. Pterygium interferes with vision. Too much exposure to ultraviolet rays, especially from the sun, leads to this growth. People whose eyes are also exposed to elements such as pollen grains, sand, smoke, wind on a regular basis have a higher risk of developing pterygium.
Individuals who are exposed to light, a lot of sunshine, those who spend a lot of time outdoors, so you have your fishermen, your traders, your miners, they usually develop pterygiums.
A pterygium doesn't always cause symptoms, and when it does, the symptoms are usually mild. Common symptoms include redness, blurred vision, itchiness, eye irritation, and burning sensation. Pterygium grows large enough to cover the cornea. Thick or larger pterygium can also cause one to feel like a foreign object is in the eye. A pterygium can lead to severe scarring of the cornea, but this is rare.
It can cause a refractive error called astigmatism, and so patients with these conditions may need glasses actually.
Using a slit lamp, doctors examine the eye with the help of magnification and bright lighting. Other tests include visual acuity test, corneal topography, and photo documentation.
Depending on how much of the cornea they cover, they can be graded into different types. And then also depending on the location. So you may have pterygiums developing from both sides of the eye. And so you can have a temporal pterygium or a nasopterygium. And then we also have what we call pseudopterygiums. And for the pseudopterygiums, usually these are not your normal type of pterygiums, which are caused by ultraviolet radiation. But usually the pseudopterygiums are as a result of either trauma or chemical burns.
For minor cases, treatment usually involves eye drops or ointment to treat inflammation. In the more serious cases, treatment involves the surgical removal of the pterygium. At a recent outreach by the Himalayan Cataracts Project Cure Blindness at the WATBORG Eye Services at SENYA BREKU, about 75 of 340 cases were pterygium related. The patients are prepped prior to the surgeries.
At first, we start by cleaning the eye. The dye is the povidone. If there is infection, the povidone will take care of that. So after cleaning the eye, that's when now we give the Arcane. Arcane is the topical anesthesia that will numb the cornea. At least it will help to minimize the pain of the injection. So when we give the injection, then the whole area of the eye, it will be numb, and the eyelid will even close.
Unlike cataract surgery, which involves the replacement of the defective lens, pterygium involves the scraping of the growth.
We excise the pterygium from the cornea, and then we take a piece of normal conjunctiva, usually from the superior portion of the eye, and then graft it or replace it from the part that was excised initially. And the reason for doing the graft is basically to reduce the rate of recurrence.
Does that make the eye regenerative, the tissues in the eye?
Yes, so the tissues regenerate, especially from the superior portion of the eye. And the reason we take it from the superior portion is because the upper eyelid covers most of that part.
Within 3 weeks after surgery, the eye is cleared and the patient can see. And depending on the type of sutures used, dissolvable or nylon, patients may have to return after 10 days to have them removed.